Practice test all healthcare careers. Question 1. A young woman, primary caregiver for her mother with Alzheimer's disease, says, "Sometimes I hate my mother for living this long." What response should the nurse offer? Option A. What do you do to cope with these feelings? Option B. Have you told your family how you feel? Option C. It's normal to feel these emotions when you are stressed. Option D. Don't worry, at least you can talk about being angry. The correct answer is option A. What do you do to cope with these feelings? The most therapeutic response assesses the client's coping strategies. Asking what do you do to cope opens dialogue, validates the feeling, and identifies healthy or maladaptive coping mechanisms. Question 2. A client with cancer is admitted with lab values HGB 12.6, WBC 6500, K plus 1.9, uric acid 7.0, Na plus 136, platelets 178,000. The nurse evaluates that the client is experiencing which condition? Option A. Hyponatremia. Option B. Hypokalemia. Option C. Myelosuppression. Option D. Leukocytosis. The correct answer is option B. Hypokalemia. Normal potassium is 3.5-5.0 mg/L. A potassium level of 1.9 mg/L indicates severe hypokalemia, which can cause cardiac arrhythmias, muscle weakness, and paralysis. Other values are within normal limits. Question 3. When providing a bed bath, the nurse aide should wash the resident's body in which order? Option A. Face, chest, arms, legs, back, perineum. Option B. Perineum, legs, back, arms, chest, face. Option C. Back, perineum, legs, arms, chest, face. Option D. Any order is acceptable as long as all areas are cleaned. The correct answer is option A. Face, chest, arms, legs, back, perineum. The recommended order is cleanest to dirtiest, face, then neck and chest, arms, abdomen, legs, back, and perineum last. This prevents spreading bacteria from soiled areas to clean areas. Question 4. Which lab test best reflects a client's long-term protein status? Option A. Serum albumin. Option B. Prealbumin. Option C. BUN. Option D. Creatinine. The correct answer is option A. Serum albumin. Albumin has a long half-life, (20 days), and reflects long-term protein status. Prealbumin has a shorter half-life, 2 to 3 days, and reflects more recent protein intake. BUN and creatinine assess kidney function. Question 5. A resident with a history of falls is getting out of bed without assistance. What should the nurse aide do first? Option A. Apply a vest restraint to prevent further attempts. Option B. Remind the resident to call for help and offer assistance. Option C. Report the incident to the charge nurse immediately. Option D. Lower all 4 side rails to prevent injury from climbing over. The correct answer is option B. Remind the resident to call for help and offer assistance. The least restrictive intervention should be attempted first. Reminding the resident to call for help and offering assistance respects the resident's rights while promoting safety. Restraints require a doctor's order and are a last resort. Question 6. The nurse aide is caring for a resident who is on strict intake and output (I&O) measurement. Which of the following should be counted as intake? Option A. Ice chips, documented as half the volume. Option B. Solid foods at mealtime. Option C. Vomitus. Option D. Urine output. The correct answer is option A. Ice chips, documented as half the volume. Ice chips are counted as intake, typically recorded as half the volume. For example, 120 ml of ice chips equals 60 ml intake. Solid foods are not measured as liquid intake. Vomitus and urine are output, not intake. Question 7. An older adult client admitted with dehydration and electrolyte imbalance is confused and incontinent of urine. Which strategy provides the best intervention for incontinence? Option A. Insert an indwelling urinary catheter. Option B. Apply absorbent incontinence pads. Option C. Restrict fluids after the evening meal. Option D. Establish a 2-hour voiding schedule. The correct answer is option D. Establish a 2-hour voiding schedule. A scheduled voiding program, every 2 hours, promotes continence by establishing a routine and minimizing accidents. Catheters increase infection risk. Fluid restriction is inappropriate for a dehydrated client. Question 8. When providing foot care to a resident with diabetes, the nurse aide should not: Option A. Dry thoroughly between the toes. Option B. Report any redness or open sores. Option C. Soak the feet in warm water. Option D. Apply lotion to dry areas, avoiding between toes. The correct answer is option C. Soak the feet in warm water. Diabetic residents should not soak their feet because soaking can dry out skin, increase infection risk, and lead to skin breakdown. Feet should be washed gently with mild soap and warm water, then dried thoroughly. Question 9. Which client statement indicates a need for assistance with bathing? Option A. I don't understand why I'm so weak and tired. Option B. I prefer to bathe myself but need encouragement. Option C. I can dress myself but need help with washing my back. Option D. I enjoy bathing independently. The correct answer is option A. I don't understand why I'm so weak and tired. Expressing weakness and fatigue indicates a functional limitation that may affect the ability to bathe safely. The client may need assistance or supervision to prevent falls or exhaustion. Question 10. Which position is best for the nurse to place the client during administration of a rectal suppository for constipation? Option A. Prone with pillows under the abdomen. Option B. Supine with the client on a bedpan. Option C. Left sims with the upper leg flexed. Option D. Right side lying, knee chest position. The correct answer is option C. Left sims with the upper leg flexed. Left sims position, left side lying with right knee flexed, allows the suppository to be inserted along the natural curve of the rectum and promotes retention by gravity, as the sigmoid colon is on the left side. Question 11. The nurse aide is collecting a urine specimen from a resident who has an indwelling catheter. Where should the specimen be obtained from? Option A. The drainage bag at the bottom. Option B. The catheter tubing using a sterile syringe. Option C. The bedside container used for emptying the bag. Option D. The collection port on the drainage tubing. The correct answer is option D. The collection port on the drainage tubing. Urine specimens should be obtained from the collection port on the drainage tubing using a sterile syringe, after clamping the tubing below the port. Never collect from the drainage bag, as urine may be old or contaminated. Question 12. A resident tells the nurse aide, I don't want to take a shower today. I'm too tired. What should the aide do? Option A. Insist that the resident shower because it is scheduled. Option B. Offer a bed bath or partial bath as an alternative. Option C. Document the refusal and leave the resident alone. Option D. Report the resident for non-compliance. The correct answer is option B. Offer a bed bath or partial bath as an alternative. The aide should respect the resident's wishes while promoting hygiene. Offering a less strenuous alternative, bed bath, partial bath, or postponing to later, maintains dignity and meets care needs. Residents have the right to refuse care. Question 13. The nurse is performing discharge teaching on a client with diverticulitis who has been placed on a low roughage diet. Which food would have to be eliminated? Option of roasted chicken. Option B. Noodles. Option C. Cooked broccoli. Option D. Custard. The correct answer is option C. Cooked broccoli. Cooked broccoli is a high-fiber, roughage, food that should be avoided on a low roughage diet. Roughage foods increase bowel motility and can exacerbate diverticulitis symptoms. Question 14. The nurse is preparing to administer a transdermal patch. Before applying the new patch, the nurse should: Option A. Apply the new patch next to the old one. Option B. Remove the old patch and clean the site. Option C. Apply the new patch directly over the old patch. Option D. Cut the patch in half for a smaller dose. The correct answer is option B. Remove the old patch and clean the site. The old patch must be removed and the site cleaned before applying a new patch to prevent toxicity from accumulated medication. Sites should be rotated to prevent skin breakdown. Question 15. Which intervention should the practical nurse implement to reduce the incidence of urinary tract infections in a client with an indwelling catheter? Option A. Irrigate the catheter with sterile distilled water daily. Option B. Dilute an antiseptic solution in the perineal wash. Option C. Cleanse the perineal area with soap and water twice daily and PRN. Option D. Apply an antibiotic ointment around the urinary meatus twice daily. The correct answer is option C. Cleanse the perineal area with soap and water twice daily and PRN. Routine perineal cleansing with soap and water, twice daily and after bowel movements, reduces bacterial migration along the catheter. Routine irrigation and topical antibiotics are not recommended and may promote resistance. Question 16. A resident with COPD is receiving oxygen at 2 ul/min via nasal cannula. The family asks why the flow rate is so low. The nurse aide should explain. Option A. The doctor is being cautious to prevent oxygen toxicity. Option B. High oxygen can actually stop some COPD patients from breathing. Option C. The resident prefers low flow because it's more comfortable. Option D. The facility limits oxygen to save money. The correct answer is option B. High oxygen can actually stop some COPD patients from breathing. Some COPD patients rely on a hypoxic drive, low oxygen level, to stimulate breathing. High oxygen flow can remove this drive, causing respiratory depression or arrest. This is a critical safety concept. Question 17. The nurse is caring for a client with laryngeal cancer. Which finding ascertained in the health history would not be common for this diagnosis? Option A. Foul breath. Option B. Dysphagia. Option C. Diarrhea. Option D. Chronic hiccups. The correct answer is option C. Diarrhea. Diarrhea is not associated with laryngeal cancer. Common findings include foul breath, from necrotic tumor, dysphagia, difficulty swallowing, and chronic hiccups, from phrenic nerve or diaphragmatic irritation. Question 18. During insertion of a nasogastric tube, NGT, into the right nares, the client starts to cough. Which action should the nurse implement? Option A. Notify the HCP of inability to insert the NGT. Option B. Flush the NGT with 30 ml of tap water to check patency. Option C. Withdraw NGT to the oropharynx, reposition the client's head, and reinsert. Option D. Continue placing the NGT because coughing is an expected response. The correct answer is option C. Withdraw NGT to the oropharynx, reposition the client's head, and reinsert. Coughing indicates the tube may be entering the trachea instead of the esophagus. The nurse should withdraw the tube to the oropharynx, flex the client's head forward, chin to chest, and attempt reinsertion. This closes the trachea and opens the esophagus. Question 19. When providing perineal care for a male resident who is uncircumcised, the nurse aide should: Option A. Retract the foreskin, clean the glans, and immediately replace the foreskin. Option B. Leave the foreskin retracted to allow air drying. Option C. Clean only the external area without retracting the foreskin. Option D. Use alcohol-based wipes to prevent infection. The correct answer is option A. Retract the foreskin, clean the glans, and immediately replace the foreskin. The foreskin should be gently retracted, the area cleaned with warm water and mild soap, and the foreskin must be returned to its natural position. Failure to replace the foreskin can cause paraphymosis, swelling and constriction of the glans. Question 20. The nurse aide sees another aide hitting a resident. What should the aide do? Option A. Report the incident to the charge nurse immediately. Option B. Mind their own business to avoid conflict. Option C. Confront the other aide in the hallway. Option D. Tell the resident to report it themselves. The correct answer is option A. Report the incident to the charge nurse immediately. Witnessing abuse is a mandatory reporting obligation. The aide must report the incident immediately to the charge nurse or supervisor. Failure to report is a violation of law and professional ethics. Resident abuse can result in criminal charges and license revocation. Question 21. When taking a resident's blood pressure, the nurse aide hears the first sound at 130 mm Hg and the last sound at 80 mm Hg. How should this be recorded? Option A 130/80. Option B 80/130. Option C 130/50. Option D 80/50. The correct answer is option A 130/80. Blood pressure is recorded as systolic over diastolic. The first sound heard, Korokov phase I, is systolic pressure. The last sound heard, Korokov phase V, is diastolic pressure. 130/80 mm/Hg is within normal range for many adults. Question 22. A resident refuses to take a prescribed medication. The nurse aide should: Option A, crush the medication and hide it in applesauce. Option B, tell the resident they have no choice but to take it. Option C, respect the refusal, report it to the nurse, and document it. Option D, leave the medication at the bedside for later consumption. The correct answer is option C, respect the refusal, report it to the nurse, and document it. Residents have the legal right to refuse medication. The nurse aide must respect the refusal, immediately report it to the supervising nurse, and document the refusal in the medical record. Coercion or deception is unethical and illegal. Question 23. The nurse aide is caring for a resident who has a stage 3 pressure ulcer on the coccyx. Which positioning aid is most appropriate? Option A, a doormat cushion. Option B, a rolled towel placed under the coccyx. Option C, a gel mattress overlay. Option D, a foam wedge under the knees. The correct answer is option C, a gel mattress overlay. Pressure redistribution surfaces like gel or foam mattress overlays reduce pressure on bony prominences. Doormat cushions are no longer recommended. They cause venous pooling and pressure at the doormat edges. Wedges under knees can be used but don't directly relieve sacral pressure. Question 24. A resident is on oxygen therapy via nasal cannula. The nurse aide notices that the tubing has become disconnected. What should the aide do first? Option A, reconnect the tubing and check the flow rate. Option B, turn off the oxygen completely. Option C, remove the cannula from the resident's face. Option D, call the nurse to fix the problem. The correct answer is option A, reconnect the tubing and check the flow rate. Oxygen is a prescribed medication. The aide should immediately reconnect the tubing and verify the flow rate is at the prescribed level. Delaying action could cause hypoxia. The aide should then report the incident to the nurse. Question 25. A resident with dementia repeatedly asks what time is dinner even after being told. What is the best response? Option A, I already told you. Dinner is at 5 o'clock. Stop asking. Option B, ignore the question since it has already been answered. Option C, calmly repeat the answer each time the question is asked. Option D, show the resident a clock and teach them to read time. The correct answer is option C, calmly repeat the answer each time the question is asked. Residents with dementia often have short-term memory loss. The most therapeutic approach is to answer calmly and consistently each time. This reduces anxiety and frustration. Teaching new skills or expressing irritation is not appropriate.